switching back to ACC now, if maybe we can talk about some of the things that will be discussed coming this Saturday at the meeting. In your executive role within the college, can you highlight some of the late breaking data, maybe if we start there, that you are maybe most excited to see how it influences research and care in cardiovascular disease?
Absolutely. Thank you for that opportunity. And so I will just deal with this on a very high level. As you know, all these studies are embargoed until Saturday morning or beyond. And in fact, I don't have information on most of those studies beyond the fact that they're included as late-breaking clinical trials. So we expect big things, positive or negative, from those studies. One I'll point out is the inclisiran potently and durably reduces LDL cholesterol in a pooled analysis of phase 3 studies. And that will be presented Saturday morning at 10:15 a.m. And again, I don't know the absolute results, but I think we're expecting some exciting results on this new drug to lower LDL cholesterol, which we do know is probably the single most important factor that leads to atherosclerosis and heart disease. So this is welcome to see that there is potentially a new drug that can be highly potent and effective in lowering LDL cholesterol. So we expect exciting, I hope, results from that study. The other that I'll mention is one called integrating risk scores, low density lipoprotein and systolic blood pressure on the lifetime risk of cardiovascular disease. And I think that's going to be also important because it's basically will give us a new integrated calculating score for patients, and physicians can look at patients and look at us and be able to predict whether or not you're higher risk. You may be healthy now, but how are you going to be in 10 years from now? Are you going to develop serious heart disease? And coming up with this new polygenic score for patients, being able to actually personalize their risk and their score, and being able to tell them, you need to go ahead and start taking steps with your diet, your exercise, and lipid lowering, cholesterol lowering agents to try and prevent the progression of heart disease, because your risk score says that you may be in that higher risk category. I think that can be very helpful for our patients. So we expect interesting results from that trial. One of the others that I think is also intriguing is the diabetes and insights from the COMPASS trial. And the original COMPASS trial that's been presented in the past suggested that one of the new or novel oral anticoagulants, rivaroxaban, could be paired with aspirin and actually lower the risk of atherosclerosis and cardiovascular events in patients who had known prior polyvascular disease or atherosclerosis, and try and prevent major events in the future. And as as we all know, baby aspirin has been something that has been touted for generations to lower cardiovascular risk long term. Just recently, I think it's been pared down to those who have had prior heart disease for secondary prevention. But this study actually looks, again, you could say another secondary prevention trial, where the addition of this new anticoagulant, novel, new, several years out, rivaroxaban, at a low dose could be added to baby aspirin in the highest risk population, the diabetics, and reduce their risk over time, over the next 5 years, of major events like heart attack, stroke, death, and the combination of those things. And indeed, I think that as in the original COMPASS trial, where it was shown in just a general population to reduce risk somewhat, in this highest risk category, and we believe diabetics are one of the highest risk groups, I think we could well see that this could be an even more impactful treatment for diabetics with vascular disease in the future, to try and prevent these major, life-altering events like stroke, heart attack, and death. So that's another very interesting trial that we hope to see Saturday morning. I believe it will be presented at 10:45 by Deepak Bhatt and associates in Boston. There's another trial, the COLCOT, COLCOT, which is an acronym for colchicine after myocardial infarction trial. And as we know, in the past, there seems to be two components to heart disease and to heart attacks. It's not only atherosclerosis and plaque rupture, but there seems to be an inflammatory component that actually leads to that. It's not just cholesterol, but it's also, and it is, but it's also the fact that in an inflammatory situation, these plaques can rupture and cause, immediate blockage and heart attacks and stroke and so forth. So various anti-inflammatory agents have been, tested in the past to see if we could help reduce risk beyond just lowering the cholesterol. And colchicine, which has normally been used in the past for gout, which is, an inflammatory arthritis condition of the joints, has now been tested for these post-heart attack patients to see if they can reduce subsequent events. So again, there's two things there. One is again, not just dealing with cholesterol, but dealing with inflammation. And I'm sorry if I digress, but inflammation from COVID-19 also may be part of this milieu of causing heart patients to be at higher risk. But if we can reduce inflammation in addition to reducing cholesterol, maybe we can truly significantly impact these outcomes for these patients. So it's not only is colchicine effective, but then that might signal that other anti-inflammatory agents are also helpful in reducing risk. So it's sort of got double importance here. So that's several of the major trials that I had looked at for Saturday morning, which is sort of the premier day for the trials. Not to belittle any of the other trials that are going to come out on Sunday and Monday, but certainly the biggest late breakers will be out on Saturday morning, and those are just a few of the ones that I saw that are not only interesting, but depending upon the results, can be extremely impactful for how we treat patients with heart disease in the future, and could even impact how we treat our COVID-19 patients.
And what's additionally interesting about that, Dr. Wilson, if you were to ask me, is the way those four sort of align with the timeline of cardiovascular care itself. You're talking about early testing methods being improved. We're talking about LDL reduction benefits with this promising agent. We're talking about continued showing of reduced comorbid risk in the COMPASS data. And then we're talking about reduced risk for a secondary event, which is critical to improve patient mortality. It kind of shows our current standing of cardiovascular care, where we understand this is a huge issue, a huge public health concern in the country. And as much as we want to stress reduction, we're also cognizant of the fact that it's already happening, and we need to ensure that, patients are as minimally affected as they can be while dealing with it. So, I mean, does that really align with the ACC's message of how you guys are, I guess, tailoring the content and discussion points that come out every year?
Absolutely. I mean, our vision is, to optimize knowledge and innovation, to try and improve cardiovascular care and outcomes on a world basis. It's not just the U.S. I mean, we are really an international organization, and I think, Atrium Health and Sanger are, really proud to be a part of that. And it's not just me, but I would say there's a whole cadre of Atrium, Sanger Heart and Vascular clinicians that are participating in these daily webinars and teleconferences to see what's going on throughout the country and throughout the world, and sort of trying to adopt those best practices of prevention and treatment for COVID-19, as well as we continue for cardiovascular care in general.